Welcome back to the Untold. Hadeel AlMusaileem, and today, this show obviously is about different stories. We hear different point of views of people who might be in the same field, but they have different stories. Ahmed, today we have an interesting guest.
Yes, I love dentistry. I love when we have dentists on the show. And today we have an amazing doctor and a specialist in anesthesiology.
Okay, I don't know how to pronounce it.
Anesthesiologist.
Are you saying it right?
I'm hoping that I am. But we'll have him on and we'll discuss his career and his passion
And I have a
for
lot of
giving
questions.
back to the community.
I have a lot of questions.
Let's not waste the time and welcome our guest right after this. Welcome back to the Untold. We are with our guest, Dr. Mohammad Abdulwahab. Welcome on the show.
Welcome, doctor. So let's start by, introducing yourself to
Yes.
us and to the audience.
And
Okay.
your specialty that we can't pronounce.
Okay, my name is Dr. Mohammad Nasrallah Abdulwahab. I'm a dental anesthesiologist. I'm a consultant at Ministry of Health at Kuwait. I'm also an assistant professor at Kuwait University, Faculty of Dentistry. I'm also visiting assistant professor at University of Pittsburgh.
All in one.
All in one. I think you get the full package.
Let's start from the beginning.
Okay,
Fresh out of high school, you decided on medicine or
dentistry,
dentistry?
Right.
Okay. You focused on dentistry straight out of high school.
straight out of high
You
school.
knew you wanted this.
Kinda, yeah. I was really good with my hands. So
Okay.
dentistry, kind of need to be an artist a little bit. And I loved medicine.
Nice.
So back then, I graduated in 96.
Okay.
So you're smart, you either have to be a doctor or an engineer. Well, I come from a family of doctors. My
They
sister
still
is a
think
doctor.
you still have to be
right,
one or the other.
which is wrong. But
yeah, of course.
so I kind of went into dentistry because I love to do things with my hands. So it was the ultimate kind of choice
Okay.
to choose
And
dentistry.
what took you to the States of all places?
Uh,
Uh-huh.
It's actually a personal thing. When the Iraqi invasion happened, I was 11, 12.
Okay.
And I kind of felt that if you go to a good country with a good degree, if anything happened, you can work anywhere, any place in the world.
Right,
So
right.
graduating from the U.S. will give you
Right.
the best degree ever. So that's kind of what I wanted to go to the States.
It was
Nice.
your backup plan.
That's kind of, but
The escape plan.
I'm not supposed to say that. Alhamdulillah, nothing should happen in
Right,
Kuwait.
right.
But
Yeah.
it's kind of, you get the best education in the States. Plus, we got kind of the American influence.
Right.
During
right.
that
We're
period,
already
kind-
Americanized here.
Right.
So it kind of made sense.
Right. And right in high school, I'm a graduate from Saleh Shab in Mishrif, so
Oh.
public schools. So,
Mm-hmm.
okay.
Yeah.
But all my friends, we kind of, most of us actually went to the States and did dentistry. So
I think still majority of scholarships are to the United States, if I'm not correct.
Not
Am I?
all of them. Now
Majority, I would say.
Not really.
No?
They you even open to like other Arab countries.
They
like
are.
Jordan.
There's so many countries.
Jordan
yeah.
apparently is amazing now with medicine. So.
I know they go to Jordan. But kind of it's easier if you go to the state for specialty.
For a special.
But
Postgrad
I
specialty.
believe going to the States is difficult for medicine or dentistry because there are not a lot of spots, no, right?
Right.
Not a lot of spots for international students.
Medicine is different than dentistry.
Medicine's
Yeah,
harder
yeah.
for
Well,
America.
the medicine in the state, there's a lot of university. They only take U.S. nationals, so
That's
have to
the
be
thing.
right
They'll focus on
their own citizens.
Yeah.
But with dentistry, they
It's
do
more
accept
open. Okay.
international students,
Okay.
and this is why
And
kind of.
what were the challenges that you faced once you decided to take that step?
language?
Language
Yeah,
barrier.
it was a big
Yeah.
issue.
Really?
Yeah, I mean, I was considered to be a better English speaker student.
And you still had difficulty.
It was difficult. Well, I mean,
I mean, the basics. I mean, I guess back then in school they only teach us the basics. We don't actually convert.
Depends on the school.
public schools.
In public schools. I mean,
I was in public school. I'm saying
Yeah.
depending on the
But
teacher,
we
the
never
situation,
convert,
and all
like,
that.
You never. Well, you learned how. We learned how to count, kind of how to ask. You learned whatever they give you to answer the test, but we never have a one-on-one conversation with anybody.
You get lost.
That's the thing.
You,
No
on paper, you
practice,
do
again.
great.
Right, but whenever
But
you go
in
into
real
the real
life,
world, yeah,
you
can't
don't
do
have the right
anything.
skills.
So how
and-
did you adapt first few months in the States?
Well, you make mistakes, they laugh at you, and
and you learn.
and you learn, and you watch TV, and you put subtitles.
What kind of
and-
mistakes that made them laugh?
Actually, the first time whenever we got our first apartment, we had to get a phone service, so you have to call.
Right.
And the company was AT&T. So I called AT&T. I barely spoke English. And whenever the guy was telling me about offers and things, I would say yes, yes,
Yes.
Yes to everything.
I didn't know.
Subscribe
Yeah,
to everything now.
exactly.
Give me the upgrade.
Yes, I always said yes,
Yes,
yes, yes. So after the first month, the bill came. It was I think $700-800 because I
Wow.
subscribed to all these extra services and the bad international rate I was
Wow.
got. So that was
Did you
funny.
pay up?
That
Actually, I had to
You
pay.
had to pay up.
that was like.
It was rough, but
That was rough.
But how did you manage to learn? How did you manage? How first of all, how many years did you stay in the States?
I graduated in '96. I stayed until 2004. Came back into Kuwait for 9 months. Then I went back to do my specialty, and then I came back in 2010. So total 14 years.
MashaAllah.
That
wow.
is a long time. So you spent most of your
Yeah,
life in there.
Yeah,
That's
most
a
of my life kind of was there.
Chunk of your life was
So,
there.
did that change anything in your, the way you
Personality?
think,
Oh,
personality, your
definitely,
mindset?
Definitely.
So what are the changes that you think happened to you personally?
Personally, on a personal level,
Yeah.
I never. Well, we kind of live in a closed society in Kuwait back then. I'm talking 96, 95. So my high school started in 92 to 96. I never thought I'm going to have non-Kuwaiti friends because all my friends were Kuwaitis. I mean, this is basically high school friends.
Right.
But whenever I went to the States, then I got exposed to different nationalities. Exactly. You meet a lot of different nationality, different people, different culture, different religions, and you kind of learn that we're all people.
Yeah.
They do respect you,
Different
respect them.
perspectives,
Right,
different
different perspective,
traditions.
different cultures. It's a good thing, and that's personally affected myself. Even now, I teach my kids this way. That you
I
have
think
to
everyone
respect.
needs to be exposed to that.
I totally agree. I totally agree. You have to be exposed to different culture and different people. The-
I'm curious, what is the difference between the anesthesia and dentistry and in general med?
and like in dental anesthesia and general dentistry.
Yeah.
So
And
basically,
why can't we utilize the one from medicine for dentistry since we had a
Okay.
lack of it? Yeah.
so basically, anesthesia in general as a science, the anesthesia provider, there are not a lot of them. It's a rare
Okay.
specialty
Okay,
in general.
In
Right.
general.
So back then, and from a personal experience, my cousin, he passed away, but he had Down syndrome. So my uncle used to have a really challenging time just to get dentistry done. So that kind of affected me personally. When I went to the special need clinic, I know that anesthesia is not provided. So if you go to a hospital, or if you go to anywhere, they say, well, we rather do, because of the lack of anesthesiologists, we rather do, let's say, a more urgent case or a more serious case than a dental case.
Okay.
So that kind of got me interested into doing dental anesthesia because we kind of more specialize in providing anesthesia to the dental patient
Right.
or
Right.
the head and neck patient. So
Right.
that's kind of the difference.
And I think it's a great tool that it's an option for people.
Yes,
Because some
yes.
people cannot
Right.
in certain situations,
We
especially special needs.
special needs,
Special.
anxiety, anxious
Anxiety.
patient.
Yeah.
We did a study, and actually, I mean, ask you this: what do you think the percentage of people with anxiety in dentistry in Kuwait? How many people are afraid from going to the dentist?
I mean, I would guess 90%.
One out of every 5 people.
I would say no, a lot. Like it's more
That
than
is a
you
lot.
think. I mean, I used to be. I'm still a little afraid, but
I hear horror
used-
stories from people, but I always
Right.
had a beautiful experience with dentists.
I'm
So it's,
not gonna say beautiful experience.
I never had a
Something
horrible
like-
experience with a dentist. I always had joyful
We're
experiences.
hated, by the way. They don't love
I don't know
it.
why kids hate dentists.
Because-
Can them
Because you have to
grow up
open
with
your
that?
mouth and let people do things to your mouth, and you're just laying down there, and you have to watch this happen to you, like, and
To you.
see things like go inside your mouth, and you're like, okay,
Did you have that
let's not
fear as a
panic.
child?
Actually, no.
Really?
I was a bad patient. Well, I had bad teeth. So
Oh.
I ended up becoming a dentist. But actually, in Kuwait,
Yeah.
we did the study, and we found out that 30% of the population have severe
has
anxiety. So
anxiety.
they don't even go to the dentist because of that.
Yeah, and then they have
I
bad-
used to do that.
A lot of
Teeth,
bad
bad
teeth,
hygiene,
but oral hygiene, I mean
Yeah.
bad oral health, and
I
that's a
used
big
to
problem.
do that for a long time. Then I decided it was time, and
Then you
I
go
went
to the,
for it, but I had to close my eyes the entire time. I was like, I don't want to hear a
Close your
thing. I
eyes.
closed my eyes the
Wow.
entire time.
So this is what we do. If you have a patient with anxiety, we put them to sleep or we sedate them, I would say.
Okay.
And then the dentist would come and they just do the dentistry, and you don't remember anything, and you just wake up right after the
I
procedure.
just closed my eyes and just let it.
Well, unless you want to hear the noise.
And there's like I believe there are two forms of anesthesia. There's the form where I'm still awake but I'm not.
Right.
What
We
is
call
that?
the
What-
level of anesthesia.
Yeah.
Isn't
So-
that scary?
I-
Isn't that like
I
a
had
scary
my,
movie thing?
Wisdom teeth.
Wisdom teeth removed with that
I had my
anesthesia.
wisdom teeth removed, but I was fully
All
awake.
four?
I just couldn't feel my entire
Did
like
you
half
take all
of
four
my-
out?
I took one. I'm gonna take the second later.
I took
so.
all four out, one session.
Let's give you sedation. Try it. Let's give you
Give you
anesthesia.
some
You won't feel it. You'll love
You
it.
just
You'll
leave.
be
The doctor
asleep.
just
You'll
gave
be
me
relaxed.
Injection, and I couldn't feel this
Yeah,
entire
wouldn't you rather
part
be
of my
asleep?
face.
Right.
No, I would rather know what's happening to my face.
We get that actually a lot of times.
Okay.
People just refuse to be
I don't
asleep.
wanna
I
go-
no,
don't
I
trust
want to.
you.
I want to know what's happening. I want to be able to, tell the doctor
I don't
stop.
know. I
when
trust the
just
people
want
I go
stop.
to, you know?
Right. I mean, that's
Trust
the whole
them, you
idea.
know?
I mean, I trust people. I just don't trust life.
You don't trust your luck, is what you mean.
I don't trust my luck. What if something happens?
What
I
if
would rather be
something
awake.
happens?
But I think it would work. So, first of all, how does this work, anesthesia? How does it work?
Is it just the gas?
Usually, what
is
you
it
see in the
the
movies
laughing
and
gas?
stuff, the laughing
The
gas.
laughing gas.
The
That's
laughing
one,
gas.
I would say, not very strong level of conscious sedation. It's a type of sedation, but the level of the anesthesia, we're not gonna get really
But
deep.
makes you happy.
Make you happy, take the anxiety away.
Yeah.
But you can do it for certain procedures, certain patient. But then, if you need to do more aggressive procedure,
so you
more
go full
advanced,
sedation.
then you give more medication through the IV. You have to
Oh,
start
yeah,
an IV, get more
IV.
monitors. You won't feel it, believe me. She's like,
She's-
no,
Like,
it's
no,
fun. It's fun.
I'm not gonna do
you'll
that.
be relaxed, and then you can do more, and then you go to the level of general anesthesia.
General anesthesia,
Right.
right?
I would
So
say
the-
tooth pain is probably the worst pain ever. I would rather have any part of my body hurt me, but not my teeth.
Well,
So that's
you'll be
my
surprised one day.
one day. I broke my legs a few times. What are you talking about?
Already. Could we go back to the laughing gas? Why is it that we call it that? And what part of it that makes you laugh chemically?
It's actually, if you get a lot of it, if you give very high dosage of
Uh-huh.
laughing gas, nitrous oxide, it affects the brain that actually you cannot control yourself, and one side effect is just laughing. So
So,
so
just
people
a
just
side
use
effect.
it to
Just start
laugh.
laughing.
Yeah, so people just use it to laugh.
So I'll go to the dentist so I can laugh.
Laugh.
I'm feeling depressed today. I'm
Can I
coming
have
to your
some
clinic.
Laughing gas.
laughing gas? Now that you said so many multiple things at the beginning, and how
Right.
do you manage your time though, and be able to do all those things that you want to
All right.
do? But we can answer that question after this break. All right, we're back on the Untold, and I believe we left our viewers with a question about how you manage your time since you are doing multiple things. You're an assistant professor at the university. You're a dentist
Right.
and a specialist.
And I'm
Right.
pretty sure.
And you said you go to a different country to
Right.
do your
Like
visitations.
visit, yeah.
Yeah.
I'm pretty sure you have a personal life too. You
Yeah,
have
I'm
friends, you have a
hoping that you
social
have a
life.
personal life, social life.
Uh,
Magic.
Imagine, I don't know.
Imagine that.
No, you just wake up kind of early and organize your time, I guess.
Are we
and have good
talking like
schedule.
5 a.m. or
No,
what?
I do
Okay.
like 6:30 every day.
Close enough.
6 a.m. If I wake up at 6, there's
Then
something
actually
wrong with me. I
something
would
wrong.
never wake up there. I sleep at 6 a.m. What are you talking about?
No, you just wake up early, you go to work, and then, I don't know, you just work.
You just manage it.
You just
You
manage
just
it.
work.
Yeah, I guess you just love it. and
Because you love it, you don't feel
you
it's
don't
work.
find an issue.
Yeah.
Exactly. And actually, after you reach a certain, I would say, level at your specialty or at your work, you just kind of
So
feel
what
it's part
are
of your
the
job, life.
misconceptions about, anesthesia, how it works, and the
That's-
most common questions that you get, what people are afraid of?
Actually, that's a good question. The
Will
first thing,
Will I wake up?
will I wake up?
Am I going to feel it?
And actually,
Is
that
it gonna be
happened because we got that movie, Awake, I think.
Yeah,
right.
that's
Oh.
exactly what comes into my mind
Right.
every
Waking up in the
time.
middle of surgery.
So that was one of the big bad hits that actually happened to anesthesia, because a lot of people say, "Am I gonna be awake during anesthesia?" And it's not like this. It's
And they
just-
shouldn't
it's
have
just
made
how
that
it works.
movie.
Right.
It's still
not
stuck in my head. I
Is
cannot.
there, do you control how long a patient can stay under?
Yes.
And
So whenever you put a patient under, you give a patient medication, you stay during the whole. You never leave your patient. You
is
just
there
stay
a
there.
minimum amount of time you could?
Minimum amount of time. You can do like
An
10
hour?
minutes,
What about the wake-up
5, 10
process?
minutes.
Oh, you can-
yeah,
you
I
can
mean, you
knock them
can,
out for 10 minutes,
depending on,
bring them
yeah,
back?
depending on
Okay.
medication
And
that
the
you give the
waking
patient.
process.
It's usually 5-10 minutes after the surgeon is done.
And you always do a countdown?
Because
Because I remember when I was
we
6,
do
they
that.
did
I
a
mean,
countdown.
sometimes patient asks us to do that. Count from like 100 to 0, or like 10 to
Oh
0.
wow!
I
He'll
think
be
I
lost.
think they only
then-
reach till 5.
10, 7, they go
Passing
to
out.
sleep. But we got a lot of question about, am I gonna be awake? Am I gonna
Feel anything?
Feel anything?
Am I gonna
remember anything?
hallucinate with things?
Right.
Like, because that's
after
my
we
main
wake
question.
up, please
It's all
make sure.
misinformation, I believe.
Am I gonna give away my secrets to people?
Actually,
Yes.
it does.
Truth
It's
serum.
not secret. It's actually after you wake up for a certain period of time, you kind of cannot control.
How long is that period?
I don't know, like half an hour. I mean, you're under. I mean,
I should be locked in a room
supervision.
with no one, so nobody. knows
exactly.
my
You never go
secrets.
to your parents, your friend, your significant other in that time.
We've
So
seen videos where
you're-
people just
you're-
wake
yeah,
up
Right,
from.
you're alone. You're actually under the monitoring of the nurses and the
But I've
doctors.
seen
Those-
videos where
yeah,
people
those-
wake up and
yeah,
they start
those-
telling their doctors or their
Like they're in love
they
or
start
something. Like, yeah,
mumbling
right,
things.
funny
mumbling,
thing.
they're mumbling. But those first 15 minutes of waking up, they're so dizzy and feeling weird and out of
Exactly.
it. Is it just because of the effects of the?
It's because of the effect of the anesthesia. So the brain is kind of taken over the function of the whole body. So this is why it's kind of, it's not 100%.
So you're trying to regain control
regain
of your
control
body.
of the
so
body,
it's going to take a few
exactly.
minutes.
So it's usually 5-10 minutes, then about
But
15
how
minutes.
weird is the feeling?
You've never went through it, okay?
No.
I just remember being so dry. I felt dry. I needed
Yeah,
water.
dry. My friend
Right.
got
I
that.
felt
Yeah.
so dry because I had surgery twice and I went under twice, and it was the same reaction as just I needed water, and they refused to give you water because of the surgery.
Because they're afraid
So
of
you're
you
just
gonna
like,
vomit, actually.
Because okay, so it's actually
So
better.
usually we wait for like an hour, 2 hours, then we give you
Ah.
a little bit of
It's
water
true.
just to make
it's
sure
true.
that
My
you can't
friend
take
just
it.
got a surgery recently, and she woke up and she felt so dry, and they wouldn't allow her to drink water.
Yeah.
They were like, you can only put a little bottle.
That's
Little
what
bit
they
of
did.
water
on
on
They're
your
gonna do
lips.
some taps, you know.
Right.
And she was hungry, and she was not allowed to eat. And
Yeah.
she has to be hungry even before the surgery. She's not allowed.
Yeah,
to
you gotta
eat for a few hours.
fast. I'm
So
sure you gotta fast.
fasting and
Right.
it's a painful process.
No, it's a good thing. I mean, look at
It's
the big
better than the
picture.
alternative.
Right. I mean, what's the alternative? Is I mean, if you have a kid, let's say you have a 6-7-year-old, and they have great anxiety to go into the dentist, they have bad teeth. What are you gonna do? Hold them down, tie them, and fight with the kid, or give them a drink, some type of a drink or a lollipop. They have special lollipops that actually have some relaxing medicine. They take it, and then they fall asleep, and then we take them to the OR or the dental chair, and they give them sedation, and the dentist will come and do the dentistry.
Full service.
It's a full service, but how do you deal with, I mean, an anxiety people they already have an anxiety, so it's probably going to be double anxiety now. Like
No, because see, that's one of the misconceptions people have. So you can give the drink. You can't give them juice, like special juice, we call it. Or we can't give them, let's say.
Special juice.
Right. I mean.
What is the special juice?
So it's actually, usually we mix Tylenol with a little bit of like some type of sedative. So it tastes like strawberry or like whatever.
You drug them with their juice.
Right. So you
Do
give
not
them
drink
that.
juice when you're at the dentist.
Well, they're coming for the anesthesia.
They're coming for
Okay.
us.
So,
So I'm guessing the parents are doing all the tricking, and here's
right,
the
you
drink.
just
Yeah.
you drink
Yeah,
it and
yeah,
then they go.
But you don't do that with adults, obviously.
Some people, yes, we do. Because
Okay.
I mean, my niece.
Special
she
needs, you
has,
mean?
no, even adults. We have
You
a
got to
lot
trick
of.
an adult into
No, you tell them we got to give you the juice or
So
the
they
special
know.
the
juice
special juice.
because you just
Yeah.
want
Gonna
it to
drink
be relaxed.
Relax.
Okay.
So we can provide you with the pain-free, relax-free, anxiety-free dental procedure.
Even though they're just coming for a cleanup, they need that too.
Right,
Oh,
if
it
they
could
actually
be
have
that
severe
simple.
anxiety.
That's simple.
yeah.
For a cleanup, they might need it. In some
Okay.
cases, they would go fully under for
right.
a cleanup.
Well, right.
Extreme cases.
Right, extreme cases.
I mean, so imagine, okay, so as a doctor, how do you deal with, the patients who are last minute? No, I'm not going to do this. I'm leaving. I changed my mind.
Okay, goodbye.
I mean, that happens.
Actually, it happens.
It happened to me
Not
once.
a lot, but it happens. I mean, we take a lot of preparation just to prepare the patient, and then
I mean,
out of
eventually you
nowhere-
cannot force them to stay.
Oh, definitely.
Yeah,
I mean,
yeah,
you need
yeah,
their
yeah.
consent just
Yeah. Of
because
course.
they're afraid. I mean, if they say
But
no,
it's
they
kind
say
of,
no.
don't you feel responsible to calm them down, to keep
You
them?
try your best to convince them, but by the end, it's their choice. If they do not consent for the treatment, you cannot just do the treatment. But we have many patients, they just wake up and they dream they had a nightmare or something, and that's really common. And they say,
A nightmare?
not a nightmare, but a vision.
Okay. Now
that's-
let's talk about the positive things about this because I want.
And they say no, and actually we feel bad for them because they just believe in that. But it's really safe. I mean, anesthesia is really, really safe. So it's not something that you should be afraid of.
Could it go wrong?
If you're an anesthesiologist, anything can go wrong. Driving a car can go wrong, right?
All
What I
right.
hear
All
now,
right.
it
Fair,
cannot
fair.
go wrong.
I mean, let's not focus
not
on giving
fair,
you.
fair,
right,
fair,
let's
fair,
focus on
fair,
the good
fair.
thing we can
Yes,
provide.
yes.
Yeah. So what are the positive things? Be positive. I need positivity.
You're having
You can-
dentistry done with
yeah.
no fear, no
Okay.
anxiety. You
No
can
pain.
treat a different, a big group of people that cannot have access to dental care without having the anesthesia provided.
Because
Special
some
need-
people could get panic
right
attacks
I mean,
before
it's
they
a big,
start.
big, population. So
Yeah.
this is
Now, why do you think this specialty, I think globally, has less specialists in it? Like, we need more. There's a lack.
right. Why? Because it's
Is it
the training programs that are only
too
offered,
complex?
and dental anesthesia only offered in the States and Canada.
Uh-huh.
So there aren't many programs. There is, I think, now is 5 or 6.
Around the world,
Yes,
there's only this many few
Right.
programs.
right.
Can't we do something to add more options?
Inshallah, if we can do it in Kuwait, but these are the dental anesthesiology program. I mean, when I graduated, my, I would say, diploma number or my membership number was 147. So I was 147
In Kuwait?
in the States, in the world.
In the world, you're
Right.
number
47,
147?
147, 147. That was my number.
Are we at number 1,000 right now?
I think we're like 700 or 800.
No,
Because there are only like
wow.
20 people graduate every year into
Interesting.
these programs. So we do, definitely we need more people. Inshallah, we're going to have more like people get interested into the program just to go and do the, educam and the training and the residency.
Oh, that's quite interesting.
Because we do need them. We do need I
Yeah,
mean, we
I
see a
can
lot
only
of
imagine,
patients
yeah.
that don't go to the dentist because
of
they
the
have
fears that
anxiety. We have special needs patients. The
And-
waiting list is long.
Oh, yeah. I
Yeah.
mean,
I lucked out with my dentist, I would say, that he offered the half-half.
Half, the IV
Half,
sedation.
you know.
We got the conscious sedation of the IV sedation.
Yeah, and I think for me, that's all I needed at that
I
time.
never got offered whatever.
Whatever.
They usually just put
Like
a
just an
normal-
injection.
an
Injection.
injection, and I just cannot feel half of my face, and I feel
Right.
paralyzed,
But you're
and it feels like
awake.
a sponge.
You're
My face
awake.
feels
Yeah,
like
you're
a
awake.
sponge.
You're awake.
I am awake.
So
And I
Do
have
you
to
like
close my
that?
eyes.
Do you like that? Being awake?
Yeah,
You don't want
Yeah,
to
you
go.
don't
I'm
wanna
in
go on
control.
it.
I can leave
control.
anytime I want.
Mid-surgery, she
Yeah.
wants to leave.
You know what? You remove half of the tooth. It's enough.
It's enough.
See you again later. But I think your job is amazing, and
Thank you.
if we think about it, we do need, the full anesthesia.
We do. I mean, for dental
If
patient.
I was approached correctly with my fear, I would do it. But I
Right.
need the right approach.
We need the right, definitely. I mean, because it's not offered,
Yeah.
so
It's
not
not
a lot.
everywhere.
It's
only,
not
like,
everywhere.
specific places.
Right. It's specific places, not offered everywhere, so not a lot of people get exposed
Right.
to that service or exposed to the idea that the service actually
Would you say there are some dentists that are against us? Against it?
against it. I
Or
don't
not
think
really?
so. Not,
No.
No, I
it's
think it helps them
it
with their
helps them,
job.
Yeah, it
Right.
helps them, doing
I mean,
their jobs and all
As a
that.
doctor, you get a patient that's fully sedated, and then no
Much easier.
complaints.
Right.
Is it easier to work on a patient that's fully sedated?
If
technically?
you're trained, yes, it's much easier. I mean,
Much
they don't move.
Yeah,
I mean,
they're
they
not moving,
relax.
yeah.
I mean, they don't kind of
It's
nag. I mean, they
Easier.
open their mouth, and it's
Yeah.
much easier.
It's much easier.
But the problem we face with some patient,
Mm.
and they don't tell us the truth about their medical history.
And some people actually don't know their medical history. So there's
That's
that.
true.
Yeah.
But I have a funny story. So I had a patient. I still remember her name, Abdullah.
All right.
She was
You
sick-
remember her?
Yeah, this is funny
Hello,
story.
Abdullah.
Hello, Abdullah.
Okay.
This is for you.
So she
No
was, I think,
doctor-patient
65
confidentiality
or 65 or something. So, so before we go to any procedure, provide anything, we check their medical history, and that's done by the junior doctor the night before. So I came in the morning, I opened her chart, and I checked. Definitely, I have all the information: her weight, her age, and everything. And I think her weight was like 80, 85. And I asked her, she said, I'm 60. So she doesn't want to tell me her true weight.
Weight.
For a female, it's usually.
But I
Right.
think you can tell by just looking at someone.
Well, I know, I mean,
Well, he can-
definitely,
he can
yeah, I
read-
can
he
tell,
can
I can
read-
read the
he can
chart.
read.
I know the truth. But the funny thing is, I went back and said, Abdullah, I have to really know your weight because I base my medication, the dosages on
The weight,
the
the
weight and
all that.
everything.
Yeah.
And she said, okay, well, I'll tell you the truth. I'm not 60, I'm 65. So she still didn't
She's still
tell me.
lying.
She left that 5 kilograms on the
So
side.
I was
Some
15
people
and-
can't, just
we,
can't face the facts.
yeah, we actually face that a lot. Sometimes this is why we always ask the patient if they have family member around them, their medical history, and then we ask them alone. Because sometimes,
the
So-
answers might change.
oh, many people
When-
actually
Yeah.
change their
When
mind.
do you not give anesthesia to patients? What are,
I mean, rejection of the
Yeah.
anesthesia, depending on health.
what are the
history.
health conditions where patients cannot?
Oh yeah, who is not eligible?
I cannot say nobody's not. You can't just give anesthesia to anybody. But
Okay.
is it safe or not? This is what we usually think about. So I cannot just go on a statement and say these people you cannot. But it's usually we measure the benefit and the risks.
Right.
So if giving anesthesia will
Is there any
provide-
health conditions where, like heart problems,
you can give anesthesia with people. I mean, people have heart surgery,
brain
Yeah, right.
problems?
brain problem. I mean, people have,
Have
brain,
brain
surgery.
surgery.
Okay, so there is
Young.
no way you go
No,
to.
there was
It's
like-
not. It's usually the benefit. If I give anesthesia, will that benefit the patient or not? Or
But you
don't?
mentioned the weighing the risks.
Right.
What are the risks?
Mostly is the most common thing is nausea and vomiting. This is usually what happens. If
Okay.
you do anesthesia, usually they wake up, they have nausea, they vomit
Well, I
sometimes.
feel like that's fine.
Not
It's
too
not
many
fine.
people. Sometimes this lasts for hours.
Okay,
and
lasts
it's
for
really
hours.
bad. Plus, if you keep vomiting and they just close your wound, it
I
increases
think
blood pressure.
Okay.
it'll get to the point where you start, because that happened to me once. I was vomiting until it got to a point where I was vomiting green stuff.
It's
Good to
just-
know.
I don't know what that is, but it was
It's just your stomach juice is kind of
stomach juice.
Right.
I don't have. I ran out of stomach juice.
Thank
And-
you for your time.
I love how in Kuwait we're privileged, but we still help others.
Of
We
course.
don't just take our privilege, things
Right.
for granted.
Right.
We give back, so that's
Absolutely.
amazing.
We're reaching the end of our episode. We're thanking you for joining us today. It was a beautiful conversation.
Thank you very much for having me.
Well,
Thank you.
we'll be back for the wrap up. What a fun episode. Quite the character, quite the doctor, quite the passion. And I loved what he said about giving back to the community.
I loved it too. And you know what? His personality is exactly what you need for a
dentist.
doctor or a dentist. Because, I don't know, people have
You
that
can trust
typical
him,
image.
you can trust him. You can.
He's a doctor I can
trust.
trust.
His knowledge.
Yeah.
And he's just phenomenal. And I wish him all the luck and all the rest of the team that's going all around the world to help those in need.
Yes, I do as well. And hopefully, we also give back to the community in our own way. I would love to do that as well.
Oh, you're adding more to the list. Okay.
No.
Great.
I mean, you can give to the community by, not littering. You can
Don't litter.
save. You
What
can
else?
save the environment. This is giving back to the community by saving the environment.
True.
Do your
Hadeel
part.
AlMusaileem 2023. All right, that's all for the Untold. We'll see you next time. Good night.
Good night.